Malacanang has approved the recommendation of the IATF to downgrade Metro Manila to GCQ status starting Wednesday. This comes after the health department projected that daily COVID-19 cases in the capital region could hit as high as 43,000 by the end of this month. Let's discuss this further with DOH Undersecretary and Treatment Czar Leopoldo Vega, who joins us now over the phone. Hi, sir. Good afternoon. Usec, I just wanted to ask if this is really the right time to gamble with a quarantine downgrade here in the NCR, especially with cases and projections for cases still on the rise.
Yeah, thank you, Sean. Thank you for having me. And first of all, with the projections that were made, these are actually based on certain assumptions on the mobility of the persons around the NCR and, of course, the transmissibility of the virus. The projection would mean that if there are no interventions done, then definitely we'd see a worst-case scenario, meaning to say that we will have 45,000, 50,000 new cases if we are not going to do anything. So definitely what is being approached by the Department of Health and the IATF right now is that we come up with a very targeted and focused kind of gradual lockdowns. No? And this is going to be different from a city-wide or a wider or a province-wide kind of lockdown, because a gradual lockdown would mean that this would be very focused and very targeted on certain communities where there are clusters of new infections. And if we can actually do a very fast and intensified testing, tracing, and isolation of active new cases within probably in less than 48 hours, and the transmission will really go down. And this is the intervention that we would like to push in terms of the lockdowns, because we know that with the citywide and the province-wide lockdown, it's now guaranteed that there will be no new cases, and it's not really sustainable in terms of socioeconomically.
Okay, Usec, what factors contributed to this big jump in the DOH's projection of 16,000 to suddenly 43,000 cases per day in a single day tally? Can you talk us through the math and the factors, sir?
These are actually projections, Sean, no? And these are based on certain assumptions. And these are really worst-case scenarios if ever there are no interventions taken. So what we're saying is that to be sure that we don't have this kind of new cases, we must be able to provide an intensified kind of intervention through a gradual lockdown. And of course, we have to ramp up the vaccination, because this will actually also help the protection of the community and, of course, the general population.
All right, Usec, how then will these projections further strain our already struggling healthcare system here in the NCR and nationwide? We've seen hospital utilization up, ICU utilization as well.
Yes, with the present number of new cases that we have, and we are looking at a healthcare utilization rate of almost at the threshold of high risk, especially for the COVID and isolation wards. But in the intensive care unit, we already have a high risk position for the NCR and some of the regions in Region 3, Region 4A, and even in Region 2. However, we do note that we are able to make sure that we will provide the necessary intervention and hope that we can lessen the transmission, and at the same time allocate or ramp up the number of beds for, especially for most severe and critical cases. We will be able to accommodate the number of patients that are needing this kind of care. So far, we are in the high-risk position, and we do hope that we will be able to lessen down the active new cases, so that there will be lessen down the hospitalization of our patients.
All right, Usec, we just recorded another record high COVID-19 cases today, 22,415 cases. Usec, do you have any idea when we can probably start seeing a downward trend? Will it be way after that 43,000? At which point can we start seeing, an easing of the number of daily cases? Or is this all up in the air because of the presence of the Delta variant?
I think with the number of cases that we have today and compare it with last week, it's really on a high-level plateau. There's a slight increase, but there's a plateauing at a high level. And I'm sure that if we can provide the necessary interventions, this will gradually decrease in a matter of 1 week to 2 weeks. But we need to be very aggressive in terms of putting down the intensification of the granular lockdown and also of the vaccination.
All right. And given, Usec, the current pace of vaccination here in the country, are we on track to reach the new target of up to 90% herd immunity, or are we still, pursuing a population protection, as we so call it?
Yes, right. We are on track, but we are hoping that we can get 70% of the targeted population before the end of the year, and we hope that we can work our the numbers of the percentages of vaccinated individuals by early next year to 90%. And we are vaccinating almost 500,000 jobs per day. So with the rate that we're going on, as long as we have the supply that comes in, especially for this September and October and the last quarter of this year, we might be able to get 70% of the targeted population before the end of the year.
All right, thank you so much for your time. That was the voice of DOH Undersecretary and Treatment Czar, Leopoldo Vega, on the line. Thank you so much for your time and sharing it with us, Usec.